Okay, everyone, welcome back to my YouTube channel again. Today, I'll be sharing with you the presentation for those of you first time ever at joining the dental industry, especially those who work in the with the equipment, with dealing with patients and dealing with the community outreach event and you need to know a little bit basic about OSHA compliance. So this is the basis presentation about OSHA compliance and how you're going to protect yourself, patient, as well as your community. Very critical information for those first time ever um, wanting to get involved with dentistry. So what is OSHA? OSHA is the stand for Occupational Safety and Health Administration. So it's established to ensure the safety and health of working condition. It's applied to all dental practice and clinic, and including the in office clinic and the community outreach clinic. So we need to have a safety net for you and for your patient. Why OSHA compliance is matter? OSHA compliance is really important because number one, it protect dental staff and patient from hazards, from chemical, from infection. Number two, it prevent workplace injury and infection. Number three is the legal requirement, and if you will not comply, we get fined. And number four is promote trust and professionalism. So OSHA's standard for dentistry, the key point is we're going to talk about the blood-borne pathogen, aerosol, and standard and hazard communication standard, personal protection equipment (PPE) standard, and general workplace safety and record keeping. So again, when we talk about OSHA standard, we're talking some basic information. Bloodborne bloodborne pathogen mean that the bacteria, the virus or bacteria that come from the blood, and how do we handle it? And number two is the hazardous communication standard. How do you manage the toxic material in the dental industry? Number three is the personal protective equipment. What kind of equipment do we need to have when you deal directly with patient or with indirectly with patient? Working safety place and got to keep the record. So very important. So this is just a quick information, bloodborne pathogen standard. I'm not going to go so deep, but I wanted you to know that some of the viruses really, you need to be aware that they are very, very uh, dangerous for a person to get infected. So this bloodborne pathogen to help standard to help to protect you against exposure of infected material. The virus that we worry about is the HIV, the hepatitis B, hepatitis C, and other virus. And when and then the require written exposed control plan. We're going to go a little bit deeper as we talk about this. Sometimes these language can be really difficult for you if it's your first time um, learning this. So regarding to the exposure control plan, you need to have the manual to review and update every year. or every 2 years. I'm not sure. I have to check on that. Identify the potential exposure tasks. What do you do when you get needle poking, or you get some sharp instrument poke you? Specify engineer and work practice control, and you need to have the workplace safety. And also number four, it include what do you do when you get exposed? Like I said, you get poked by the sharp instrument that carry blood. How do you? What are the protocol? Regarding to this, the post-exposure evaluation protocol, it's including immediate action. Um, how do you care for this? You care for the exposure side by immediately wash them, the needle stick injuries, and cut with soap and water and alcohol. For the splat of splash to the nose, mouth, or skin, flush the area with water. For eyes exposure, irrigate your eyes with clean water, saline, and sterile wash. Number two, you report the incident, inform your supervisor and the designated person in charge of managing exposure with immediately, especially when you operate in the community outreach event. You need to work with the dentist leader, um, or oral surgeon leader, whoever is the leader, need to let them know. And second, third thing is you seek immediately for the medical evaluation. You got to go to the healthcare professional, such as provider at the employee health clinic, emergency room, as soon as possible. Some treatment must be started within hours before it, after the exposed, and the documentation of the incident, the detail what happened, must be written. Um, very, very important. So, regarding to the medical evaluation and testing, first, when you get the needle exposed, or sharp instrument cut on you, first thing that you need to know, identify the person that the sort of individual blood, whether that person is get tested with HIV, hepatitis B, hepatitis C. If that person is a carrier, then there's a next step that get involved. Or also you also need to test basic test with the testing for yourself, whether you need to get the blood withdrawal test, whether you already what type of medical problem that you have, whether you already a carrier or any of these viruses. If you're not, you got to get vaccination from these. And then on top of that, if that person, the blood of the person that you get hope carry any of those viruses, it need to be immediately treated with antiviral medication. I'm gonna go deep at if it really happened to you, right? So and follow up, you have to have a record follow up. All these protocols need to be follow up. And when you go to the clinic, they will give you the time when you come back. You're going to be seeing the clinician and will walk you through the step by step. So don't want to scare you, but you need to have a sense understanding about exposure. And we're going to talk about a universe of precaution. We got to treat every blood and bodily fluids as infectious. So that means that you need to use glove, mask, eyes protection, and gauze. You also have to use hand hygiene before and after every patient. You need to protect the patient as well as yourself. If your hand is dirty, you put your glove on, you can cross-contaminate and cause your patient to be infected as well. It's not just about you, but your patient as well. Safety handling the sharp instrument, very important. All those sharp instrument, when you take the tray back to your outer place side, you need to make sure you um, finish cleaning up the sharp equipment first. Put aside every sharp instrument like needle, anything sharp, clean them up first before any other instrument. For example, you see that the needle is needle. You can see that there's a sharp needle handle and also internal sharp here. Very important to know how to handle it. We're gonna go hands-on with these. Also, the record keeping with the sport test. Every equipment after uh, each protocol, surgery instrument need to be autoclaved, sterilized, autoclaved, and then spore test to make sure that all those bacteria and virus are no longer alive. Number three, I'm going to touch on the personal protective equipment, PPE. We're talking about the glove, single use only, ladies and gentlemen. You only use it one time. You cannot use the glove on one chair and then you run to the other chair and you still using the same glove. That is a no-no. I see this is a misuse in restaurant. And you go to a restaurant, you see people or the cashier use the glove, and then also you bring the food to the patient to the customer. It's a mess. Make sure single-use glove and do not walk around with one glove and just go to bring something out and to the chair. Very, very um, uh, risk for cross-contamination. Mask and eyewear change between each patient. Gown, lab coat, remove before leaving the workplace. Proper uh, downing and roofing technique. Make sure you know how to clean it. So this is a picture of the this is me. You can see that at a typical day, I work. I wear mask, eye protection, and also face shield protection glove and gown. That's the basic. If you work with environment with a lot of aerosol, you have to wear hair cover, head cover. You cover yourself. So this is a typical PPE. Just go over quickly, the basis of the surgical tray. You can see that you have a number one thing is cotton roll, two is Q-tip with anesthesia, topical anesthesia, three is the 2x2 gauze, and four is a needle, five is the local anesthesia, lidocaine, and number six, you can see it's the syringe, mouth mirror, number seven, number eight, explorers, and perio probe. Number nine is small elevator to remove the tooth, to luxate the tooth. Number 10 is a big elevator. Number 11 is peristeel elevator. Number 12 is the correct. All right, and hand hygiene protocol. Um, Ideally, after you should use soap, disinfect your hand, wash with water, alcohol based or artificial nail or jewelry during patient care should be removed. Remember, I want to share with you hazardous communication. It's called um, cover all your hazardous chemical use in dentistry. Usually we have in dentistry is amalgam. We have some uh, bromocresol, so that very toxic, um, and uh, and any other label in the dentistry that is would label chemical hazardous. You have to make sure you know where to put them back. chemical safety. You make sure you use proper storage and disinfect, and also use the the fuel hook to properly suck out when you're dealing with these sometimes. Uh, and a near emergency eye wash station available. Sterilization is infection. Make sure that your autoclave machine have to be up to the standard, and spore test weekly using maintenance log and record. Waste material, everything had to be in the red sharp container or biohazardous container to be they're disposed. Emergency preparedness. You need to have a location for fire extinguisher access. Maintain first aid kit and eye wash station. Manual drill and emergency plan. CPR and first aid training encouragement. Record keeping requirement. All those exposed incident training, attending log, um, sterilization and maintenance log, hepatitis B vaccination log, employee training, initial and annual OSHA training requirement must cover bloodborne pathogen and hazardous communication. Um, Training document retained for 3 years. One of the common violation in dentistry and dental office is missing exposure control plan and improper label um, of standard of care access, reuse of single use of PPE, or lack of training or documentation. So building a safety culture to is encouraged, require open conversation, report hazards immediately, uh, led by example, comply and start with leadership, reward safety and consciousness behavior. In summarize, remember OSHA compliance is safety, ethic, and professional. Review and update safety protocol every year. Protect yourself, your team, and your patient. Thank you for watching. If you have any questions, let me know.